You're turned on, she's into it, everything is going perfectly, and then it's gone. And the worst part, it's not just the erection you lose, it's your confidence, your enjoyment, and eventually your desire to even try again. I'm Dr. Conrad, a urologist and pelvic surgeon, and I want to be very clear with you right now. This is one of the most common things men come to see me about. You are not broken, but you do need to understand why this is happening. Because of some of these reasons, they will genuinely surprise you. Let me quickly explain how an erection actually works, because once you understand the mechanics, everything else makes sense. When you're aroused, your body activates what's called the parasympathetic nervous system. Your rest and digest state. That triggers the release of nitric oxide, which tells your arteries to relax and open up. Blood rushes into the spongy tissue inside the penis, it expands, and tiny valves in the veins close, trapping that blood inside and creating the pressure needed to stay hard. Simple, right? But there are so many places in that chain where things can go wrong. Here are the 6 real reasons it's happening to you. The first one is a medical issue you probably don't know you have. The number one cause of erectile dysfunction is vascular, meaning your blood vessels. And here's the part that should make you take this seriously. Men diagnosed with erectile dysfunction have a 14% chance of having a heart attack within the next 7 years. That is not a small number. The blood vessels in the penis are roughly half the size of the ones supplying your heart. So when something is going wrong in your cardiovascular system, high blood pressure, high cholesterol, diabetes, your penis shows the warning signs first, before your heart does. These are silent diseases. You won't feel them. You won't know unless you get checked. So please go see your primary care doctor. Get your blood pressure checked, your cholesterol checked, and your blood sugar checked. And while you're there, get your testosterone checked too. Low testosterone is incredibly common and incredibly easy to test. It's just a simple morning blood draw. Your erections are a window into your overall health. If something has changed, that appointment might be the most important one you ever make. The second reason is your brain. The moment you start thinking, am I going to lose it? Is she enjoying this? Why isn't this working? Your body switches into fight or flight mode. And in fight or flight, blood vessels constrict and blood actively leaves the penis. Your brain is your most important sexual organ. Not your penis. Your brain. And here's the brutal cycle. You lose your erection once. Now you're anxious about it happening again. So the next time, you're in your head. And because you're in your head, it happens again. And now it's worse. And it just keeps spiraling. The way out of this? Talk to your partner. Consider a sex therapist if you're really stuck. And this might sound counterintuitive, take penetrative sex completely off the table for a while. Be intimate without the pressure of performance. Touch without the expectation of sex. Let your confidence rebuild naturally. Sometimes a low-dose daily medication like tadalafil, just 5 milligrams, can give you enough of a boost to break the cycle and get your confidence back. Third, your sensitivity has decreased. As men age, the nerve endings in the penis become less sensitive. Less sensation means fewer signals reaching your brain. Fewer signals means less arousal. Less arousal means the erection weakens or disappears. This doesn't mean you're done. It means you need to adapt. Your nervous system doesn't just process regular touch. It also processes vibration, temperature, and light touch. So experiment. Use vibrating toys. Try warming or cooling lubricants. Use something soft, like a feather or a scarf. Different stimulation activates different nerve pathways, and that novelty alone can dramatically increase arousal. Fourth, you're not as aroused as you think you are. Men are expected to get hard instantly and stay hard indefinitely, but you're not a machine. You need to be both mentally and physically aroused before penetrative sex. And a lot of men skip the steps that get them there. If sex is always the same routine, or if you're being rushed, you might only reach a partial erection and try to push forward anyway. More foreplay, more novelty. Make sure you're at peak arousal before penetration even begins. This alone fixes the problem for a lot of men. Fifth, your medication is doing this to you, and nobody told you. This one makes me genuinely frustrated because men are almost never warned about this when they're prescribed these drugs. Antidepressants, especially SSRIs, are the biggest culprits. They can kill sexual desire, make it hard to maintain an erection, and make orgasm difficult or impossible. Beta blockers for blood pressure and heart conditions, same issue. Even some older antihistamines interfere with the parasympathetic signals your body needs to get an erection. And finasteride, used for hair loss and enlarged prostate, has real sexual side effects too. Now, these effects don't happen to everyone, but for the men they do affect, it can be severe. Do not stop your medication without talking to your doctor. Some of these, especially blood pressure medications and antidepressants, can actually make things worse if you stop abruptly. But do have the conversation. Tell your doctor that your sexual health matters to you. In most cases, there are alternatives, dose adjustments, or other strategies available. You just have to ask. And sixth, this one is massively underdiagnosed and almost never talked about: sleep apnea. Sleep apnea causes repeated drops in oxygen levels throughout the night. Your body responds to those drops by releasing cortisol and adrenaline, stress hormones that constrict blood vessels and suppress testosterone. Over time, this creates exactly the vascular and hormonal environment that kills erections. And study after study shows that men with sleep apnea have significantly higher rates of erectile dysfunction than men without it. But here's the good news. Treating sleep apnea with CPAP therapy has been shown to meaningfully improve erectile function. Do you snore loudly, wake up exhausted, no matter how much sleep you get? Has a partner ever told you that you stop breathing during the night? Do you carry a weight around your neck? Do you smoke or drink regularly? Any of those? Get evaluated. A sleep study can now be done at home. It's simple, and treating sleep apnea doesn't just help your erections. It improves your testosterone, your cardiovascular health, your brain function, and how long you live. Here's the bottom line. Losing an erection during sex is common, but common doesn't mean you have to accept it or suffer through it in silence. Understanding why it's happening is the first step to fixing it. And some of these causes are serious enough that catching them early could genuinely save your life. See your primary care doctor. See a urologist if you need to. You deserve real answers.